Hi, welcome to our series, Know Your Health. My name is Dr. Topailari and I will be your host today. And the topic we are focused on right now is known as PCOS, which stands for Polycystic Ovarian Syndrome. Now, this is a very, very common condition that a lot of women are facing, or a lot of women have, and a lot of people know about it, but they don't know a lot about it. Now, the problem with this PCOS is that in Nigeria as a whole, we have about 18% occurrence amongst childbearing females. So, women within the ages of 17 to 45, we have 18% of them having PCOS. Now, I didn't use the word diagnosed because a lot of people have not been diagnosed to have PCOS, but they have the symptoms and they probably do not know what is going on with them. A lot of times too, they will just assume that they are getting older. So that's why things are looking the way they are. They are not as voluptuous as they used to be or as curvy as they used to be. So they assume that, well, age is catching up with me. But that's not the reality. It is PCOS. So imagine in Nigeria, 1 out of every 6 female of childbearing age has PCOS. Now, that is a very, very, very high value. Very, very, very high occurrence. That means if someone you know or you has PCOS. Now, what is this? What's the problem with PCOS? Why is it such a bother? Well, the thing is that if you do not know that you have PCOS, you could actually go through life still not knowing, but the symptoms will not go away. And the end stage of this condition could be really, 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 really bad. So that is why it's important for every woman to check to make sure she doesn't have it. And if she does have it, manage it to the best of her abilities or to the best of our abilities as healthcare workers. Now, there is no known cause for this condition and there is no known cure. Now, I'm not describing it as a disease because it is not a disease per se. It is a syndrome, meaning it is a collection of different signs and symptoms and malfunctioning that comes together, and that is what we term as PCOS. So that's what it is, and it could be very, very disturbing for a lot of women, particularly women that are trying to get pregnant. In fact, 90% of the women that are diagnosed to have PCOS in Nigeria got the diagnosis due to infertility. So they were trying to get pregnant. Eventually, they went to the doctor, and then the doctor did some tests and then realized that they actually have PCOS. So that's how most of them get diagnosed. But those that are not looking for babies, they're not trying to get pregnant, a lot of them go undiagnosed and they just leave the condition the way it is, thinking that's what life has for them. But that's not the reality. So PCOS is not exactly a disease, and it is a combination of different malfunctionings together. Now, this malfunction is there are 3 triads of it, 3 types or 3 combinations that you see very commonly amongst women. So the first one would be the hormonal imbalance. We're going to take time and explain all of these. We have the hormonal imbalance. So when we're talking about the hormones, the hormonal imbalance, we are looking at the sex hormones, the female and the male sex hormones. So basically, a woman should have more female sex hormones, but in this condition, she tends to have more of the male sex hormones. So rather than having a lot of estrogen, she's having a lot of testosterone. Every female has a very little amount of testosterone in their body, but for women that have PCOS, they have a large amount of testosterone. So imagine you're a female, but you have male hormones. How's that going to make you look? Yeah, you're going to end up with some male features that you don't want. So that's the first issue with this. And then the second issue is metabolic disorders, meaning the way you process all your functionings in your body. So when we talk about the metabolism, it has everything to do with your digestion and your production of hormones and your energy spent and your fat storage and everything put together. So it messes up with your metabolism basically. And there is a major metabolic disorder that is associated with PCOS, and that is either type 2 diabetes or insulin resistance. We're going to talk about those two as well and explain them, break them down so you'd understand what is going on and how you can fix it. And then the third, of course, is the infertility. So infertility comes as a result of the person having more testosterone in their body, and again, a malfunctioning of the menarche, basically the menstruation and ovulation and all of those things that make you a woman. You have your period, you have your ovulation, and then you're able to get pregnant. So there is a disconnect with all of them. Everything is just malfunctioning, and then the person tends not to ovulate. Sometimes they don't even see their period. Sometimes their period is just all over the place. It's just scattered. They can't even tell when the period is coming, when it's ending. Sometimes it's just like, it comes in drops, and sometimes it comes like a flood of rivers, So it's very chaotic. And with that, pregnancy, of course, is almost impossible. So these are the three major triads that we see with PCOS, the three major, conditions that we see with PCOS. And that's why it is such a difficult situation to deal with. Now, I said that we do not have a cure for it because there is no known cause. Like, why? Why did the person come up with it? There is no known cause. Like, we don't know how or why it happens. We know that some people have some kind of affinity towards having more male hormones, and that is more genetic. So a woman is born and she has a higher tendency to have more testosterone. So we say people that have that higher tendency, they do have a much higher tendency to come up with PCOS, but that's just for a fraction of people. But for those that do not have a higher tendency to come up with testosterone, why do they come up with PCOS? We have no clue. So it just happens. All right. So since there is no known cause, there is no known cure. But even though there is no known cure, every symptom that is associated with this PCOS can be treated, it can be managed, it can be taken care of. And if all the symptoms are taken care of and managed, then the syndrome is no longer there. That's the good thing. Because when we say it's a syndrome is a combination of various conditions that make a classic appearance or a classic type of, disease state. Let's just put it that way. So when you deal with the individual conditions, the individual malfunctionings, then the syndrome no longer appears. So that's the only way that we treat PCOS. And if the treatment is done properly, the person or the female should be free of it for a long time. But she has to be aware of a reoccurrence. So there are certain things she needs to look out for, and then there are certain things she has to do, down the line to ensure that she stays on, the healthy path and not go back into PCOS. Now, if you say, oh, well, I'm not looking for babies, so I don't have infertility issues. It doesn't matter if I get pregnant or not. So even though if I have PCOS, then fine, I could live with it. Well, not exactly, because PCOS actually has an end stage, because after your body is being ravaged by all of these symptoms and all of these malfunctionings, eventually it comes to a point where your body can no longer handle it. And then there would be a disease condition now that would end up being terminal. And such disease conditions is like, we call that the non-alcoholic fatty liver. So your liver, your liver is like the organ that does all the manufacturing in your body. So it's like a warehouse where they produce a lot of things. That's what your liver is like. And your liver is the organ that gets the biggest hit from all the malfunctionings of PCOS. So eventually the liver is going to say, you know what, I'm done. I'm tired. I ain't doing this anymore. And it stops reproducing its hepatic cells. That's its own type of cells. And the cells are now being replaced with fats. And when that happens, fat cannot do the functions of liver cells. So eventually the liver is going to die out. So that is one of the most common terminal stages or state of PCOS, which of course has to be avoided by all costs. Then some very uncommon ones, we have heart disease. They end up with, you know, myocardial infarctions, meaning their heart muscles lack oxygen and blood supply for some reason. So it dies out, and then the heart begins to weaken, over time. It doesn't pump as much as it should pump. It doesn't pump as strongly as it should pump, and all of that. So that is another end stage that should be avoided, because there are other things that come as a result of PCOS if it is not treated. So apart from the common triads that I talked about, there are others that you would notice. Those would take some time and explain them. But the most important ones that I would need you to pay attention to, that comes as a result of PCOS, but not as a triad of it, meaning it's not one of the major conditions or malfunctionings that creates the PCOS, but these are other symptoms that come as a result of this three major conditions. All right. So the person or the female is always depressed. Most of them are depressed, are usually depressed, and they do not understand. They just feel like, oh, maybe they are sad because they're not able to have babies. But it goes beyond sadness, because even in some cases, if that depression is not taken care of, and the woman ends up getting pregnant, she ends up with postpartum depression, and then it continues from there. And she's wondering, like, okay, I thought having a baby was a problem, but now I do have a baby. Why do I still feel sad? And it goes on like this. And if it's not taken care of, you find the woman doing some really extreme things, like killing herself or even killing the baby. So depression is something that needs to be looked out for. Then, of course, we talked about metabolic disorders. Diabetes is part of it. But another thing you need to know, most of these cases, they end up with high blood pressure. They have a high blood pressure. And funny enough, a lot of people in Nigeria do not take care of themselves. Like, they believe if they have a high blood pressure and they work out, do some kind of exercise, their blood pressure will come back to normal. But that's just a lie from the pit of hell, truly, because it's not going to work out, not that way. If your blood pressure is high, consistently high, and it doesn't go down except with medication, doesn't matter what you do, you still have to take the medication. So high blood pressure is a very common feature of PCOS. High cholesterol is actually a very, very high feature. In fact, one of the end stages, they have lots of cholesterol deposited in vital organs, and that could end up blocking up arteries and destroying those organs itself. So that's usually one of the end stage. But it starts with high cholesterol, then the cholesterol level gets so high that it's now everywhere in the body and blocking up everything. So high cholesterol is something that needs to be looked out for. All right, then we've talked about the high heart disease. So these are conditions that are very common, symptoms that are very common with PCOS. And we're going to take some time to break it down. So this is just the introduction to let you know what PCOS is and how they present, and of course, something that you should know about. So if you sit tight, we're going to talk about the process of the disease, and also we're going to talk about how to diagnose this condition and how to treat it. So there is the medical type of treatment and the non-medical type of treatment, and I'll be covering every aspect of that during this teaching. So sit tight, and I will see you soon. Okay, bye.